Today, the American Heart Association put out its first guidelines for preventing strokes in women. Strokes happen when a blood vessel to the brain is blocked or bursts. They are the third leading cause of death in women, and Dr. Jon LaPook has more.
3 years ago, Cheryl O'Connor, a registered nurse, became her own patient when she suddenly had trouble forming words.
As a nurse, I said, "This feels funny." I got up and I went into the bathroom, did a quick neuro exam on myself. I said, okay, something's not working right.
At age 49, she was diagnosed with a stroke. Dr. Andrew Rustman is a neurologist at the Cleveland Clinic.
Well, I think it's very important that we have a set of guidelines that raises awareness among women, especially women who don't traditionally think of themselves at risk for stroke.
For both sexes, risk factors include age, high blood pressure, smoking, and high cholesterol. Today's report outlines the unique risks women have, including gestational diabetes, use of birth control pills, especially for those who smoke, are hypertensive, or have clotting problems, and high blood pressure during pregnancy, which can lead to a condition called preeclampsia. Women with a history of preeclampsia have an increased risk for stroke even 30 years later and should be closely monitored. Other factors that impact women more than men include an irregular heartbeat called atrial fibrillation and severe headaches called migraine with aura. O'Connor had a history of severe migraines.
I just figured my migraines were because, like they had told me years ago, it was the hormones. And so I didn't, and I never would have equated it with a stroke. Never.
The guidelines suggest aggressive treatment of hypertension, especially during pregnancy. And when there are known risk factors, doctors should monitor those women closely and suggest lifestyle and medication interventions to lower the odds of getting a stroke.
Thank you, Doctor.